Hi, good afternoon. Thank you for joining us today. My name is Lori Smetanka, and I'm the Executive Director of the National Consumer Voice for Quality Long-Term Care. This is the next installment of our webinar series, COVID-19, Advocating for Nursing Home Residents, sponsored by the Consumer Voice, the Center for Medicare Advocacy, Justice and Aging, and the Long-Term Care Community Coalition. Our purpose in holding these webinars is to keep you updated on the latest information, guidance, and actions at the state and federal levels related to COVID-19, talk about the impact on residents of long-term care facilities, to share resources and offer recommendations for advocacy. I was looking earlier today at some data from the Kaiser Family Foundation, which has been tracking the number of COVID-19 cases and deaths in long-term care facilities since March. And that data showed that we have surpassed really the unbelievable and tragic figure of 50,000 plus deaths in long-term care facilities, according to reporting by just 41 states. So this really does show the continued need and urgency for the advocacy that we all have been doing together on behalf of residents. Next slide, please, Libby. So today we're going to be talking about immunity from liability, which is something that the long-term care industry has been pursuing at state and federal levels. And we're also then going to be talking about the requirements related to the prevention of abuse, neglect, and exploitation, and talk about it through the lens of COVID-19. At the end, as usual, we'll have some time for discussion and questions. Next slide, please. Our speakers today include Sam Brooks, who's a program manager with the Consumer Voice, and Richard Mollett, executive director of the Long-Term Care Community Coalition. A reminder that today's webinar is being recorded, and the recording and slides will be emailed out to participants next week and also will be posted on the Consumer Voice website. There you can also find the recordings and slides from previous webinars, and we will be putting links to today's slides in the chat box, and you'll be able to download them from there. All lines are going to be muted throughout the webinar. Please post your questions for the presenters in the Q&A box on your control panel, and please use the chat box to make comments or discuss points among yourselves. And as I mentioned earlier, after the presentations, we'll get to as many questions as we can for today. And next slide, please, Libby. With that, I am going to turn it over to Sam, who's going to get us started on presentations for today. Sam?
Great, thanks, Lori, and thanks to everyone for being here. I'm going to talk today about the movement nationwide, both in the state level and the federal level, by the nursing home industry to obtain immunity from civil liability, and in some instances criminal liability, for harm they do to residents of long-term care facilities during the COVID-19 pandemic. As Lori said, the somber number of 50,000 people or residents have died since and that's probably an undercount in many ways. But since then, there's been the disturbing trend also of facilities asking for immunity. So we're going to jump right into it, and I'll take you through the issue. Next slide, please. So currently, and we're going to talk about states first, currently 28 states have granted some kind of immunity from civil liability to nursing homes and or providers in nursing homes. 18 states, give or take, we're not, the information on assisted living is a little more hazy, have provided immunity to assisted living facilities. 3 states have provided criminal immunity. At the bottom of this slide, you will see a link, and you can go to our webpage. There's an interactive map there where you can click on the state you're interested in, and it will give you a variety of information, but also we'll talk about immunity in that state, whether it's been adopted, how it's been adopted. We'll give information about the length of the immunity order, and also give a link to the actual order or law. So we encourage you to do that, to take a look at that after the webinar. Most of these orders, or excuse me, most of these provisions have been created through executive orders signed by governors, but also there's now trending to be more legislation passed by state legislatures. most of the orders or executive orders or laws only excuse negligence. And we'll get into all these terms just so people understand better. And majority of them only extend through the duration of the emergency. And what that means is it ties it to a governor's declaration of an emergency related to the COVID pandemic. Next slide, please. So let's talk about what does this term immunity mean for residents and families? And we've been trying to use the term avoiding accountability, because that's essentially what this is. What most of these laws and executive orders do will absolve facilities whose negligent acts results in the injury or death of a resident, which means they won't face accountability in courts for those injuries. In many states, if not almost all, injuries or death totally unrelated to COVID-19, and we'll go through some hypotheticals in a little bit, will fall under these provisions, which means they will capture people that were harmed or even died as a result of the facility's negligence, but did not have COVID. To us, it's not just about being able to sue someone, it's also removing one of the remaining oversights in the long-term care facilities. For years, the quality of nursing home enforcement has declined, but one of the things that have remained true is that nursing homes will be held liable in court for any harm that they caused to residents that was a result of their negligence or failure to provide quality care. And by removing that, you're removing one of the last remaining oversights in facilities. Ombudsmen aren't in facilities, state licensing agencies aren't entering facilities as much, and most importantly, families aren't in facilities able to monitor and to advocate for their loved ones. So really right now, one of the last remaining oversights, and although it doesn't act like an ombudsman, it acts sort of as a silent overseer that tries to guarantee better care for residents. And it also reduces the likelihood that facilities will comply with laws and regulations. It's a great incentive to know that you're going to be held accountable in court for your failure to comply with the law and regulations, often coerces facilities to provide better quality care. And we're removing that, these liability waivers, provisions. And importantly, many families will never know what happened to their loved ones during the COVID-19 pandemic. Many families have just received calls that their loved one has died and aren't receiving explanations, and they'll never know. And historically, litigation has always been a way to discover what went wrong. Through the litigation process, you can get documents and you can find out just what happened. And by removing that, we're forcing a lot of families who have lost loved ones or whose loved ones have been harmed just to go without knowing whatever happened. Next slide, please. Other concerns. I mean, essentially what we're doing is rewarding facilities with histories of poor care quality by allowing them to escape accountability. It's become clearer as time goes on by looking at inspection reports, hearing from families, hearing from residents, and reading the papers, that a lot of the harm that is befalling residents isn't because of lack of personal protective equipment or short staffing. It's from poor care. It's from failure from training staff in proper infection control. I was just reading some inspection reports in a particularly bad facility in the Pittsburgh area here. And most of the staff hadn't been trained in hand washing in the previous year. And 60 residents have died there. And it was clear that it was the result of very poor quality care and poor infection control. And so we're essentially rewarding facilities who have for years cut back on staff and cut back on quality of care to maximize profits. And not only are we rewarding them, we're saying to facility residents and their loved ones that they have to pay, but facilities don't. And even though there are time limits on some of these orders and laws, or on the orders and the laws, excuse me, who knows how long this emergency will last? This could be months, could be years. And during that time, facilities will escape liability for a lot of things that could have been prevented. Next slide, please. So, as I said before, really how it's being granted, these immunity provisions are being created are either through executive orders that are signed by governors or through laws. The executive orders, many of them seek to incorporate healthcare facilities, including long-term care facilities, into existing emergency laws regarding immunity, saying from now on, from going forward during the pandemic, nursing homes or assisted living facilities are considered immune under this provision. Other executive orders are just coming out and saying it with no basis in the law, and the governor is just declaring that facilities will be held, will not be held accountable. For the most part, they're retroactive, and as I said before, and by retroactive I mean basically the language says it will go back from the beginning of when the governor declared the emergency, and it will extend to the end. Next slide. So what do these laws do? What they do and the executive orders do is they, for the most part, all of them, almost all of them, excuse negligent behavior. And what does that mean? Negligence means that the facility failed to act in a manner that an ordinary person would have in the same situation. So what that says is that, especially in the nursing home industry, there's established standards, there's established protocols of care. And deviating from those is negligence if it causes harm. And that's what's important about this, is that this standard already offers facilities sufficient protections. Many of the facilities are saying, well, we're having shortages in PPE or shortages in staff. And when it comes down to issues like that, when, say, acts of God, such as a pandemic, prevent a facility from getting proper, say, PPE or proper hand sanitizing equipment, or even proper staff, that's considered already in court. You can't expect a facility to do something that other facilities couldn't. What these laws and executive orders aren't excusing that. That protection is already there. What they're excusing is behavior where a facility acts in such a way that the harm comes not from the fact that they didn't have PPE, but this because they didn't exercise the proper level of care and conduct themselves in a manner that other facilities would in that situation. The most important thing is the large majority of cases brought against nursing homes are based on a theory of negligence. People are surprised to hear that most deaths that result from harm from a facility come under negligence. And that becomes important in this next bullet, because most laws and executive orders have exceptions. And what the exceptions are is that the plaintiff or the resident or their family will have a higher burden of proof. They'll have to show that, sure, the facility acted negligent, but we're going to ignore that. What we want you to show is that they did it on purpose. They acted recklessly, willfully, or grossly negligent. And what that means is that the facility knew it was acting in a poor way, it was ignoring a risk, but still took that step. And that's very hard to show. It requires a proof or intent or knowing disregard. And to be able to show that is something that is not common in days prior to COVID. Most people who take these cases, most attorneys will tell you that it's negligence that most suits are brought under. So it's a very high burden to meet. So just saying that these types of acts, like reckless acts, won't be excluded, really is a red herring, because by allowing negligence, you're allowing the majority of behavior that really harms residents. Next slide, please. What is also, there's in most of these orders and most of these laws, there's components to them, or there's factors that have to be satisfied, but they're very loose. And in most instances, the harm or death that the resident suffers doesn't have to result because the person had COVID, but only related to the facility's response to the pandemic. So if the facility can say, oh, we were following an emergency order issued by the governor, or we were dedicating our we were dedicating staff to COVID residents, they're likely going to be excused from this negligent behavior because they can just say, well, we were treating COVID residents. I think it becomes a surprise that the majority of these laws doesn't even relate to the harm being from COVID, just that you're in a facility where they were treating COVID residents, or even, it's likely even that they took steps to prevent COVID coming into the facility. We could see some facilities arguing that negligent behavior that resulted in harm when they never even had a COVID case could be excused. And also, most of the executive orders and laws require the action or inaction to be in good faith. And what that means is the actor, knowing that there was, say, negligence would be excused, didn't purposefully act in a negligent way. They acted in such a way, honest way, and in good faith, but nevertheless, they were still negligent. And these are terms that are so hard to say because we're excusing just egregious behavior. So it's hard to say, oh yes, you were negligent in a good way, not a bad way. And that's what's absurd about this. Next slide, please. So let's talk about some hypotheticals to highlight this. Say, for instance, a resident with dementia, diabetes, and limited mobility is living in a facility. Facility fails to properly assist the resident with eating, drinking, and fails to reposition her. As a result, she develops pressure ulcers, which become infected, and she dies from sepsis. This resident didn't have COVID. It's not clear that anyone in the facility had COVID. However, if the facility is able to tie its negligent behavior to the fact that COVID was present in the community, or it was taking some sort of action to the possibility of COVID, it's likely that this type of negligent behavior that unfortunately we saw well before the COVID pandemic would likely be excused. Next slide, please. Or say even in an instance where there is a resident in a facility where the staff is not properly trained in infection control. So the resident gets COVID, but it's not because the facility didn't have PPE or they were overwhelmed. It was just because they didn't train their staff in proper infection control. And as a result, the resident became infected with COVID and unfortunately passed away. And again, even though this seems a little more tied to COVID and the COVID response, it's likely that a facility just won't face liability for this. We can see facilities arguing, oh, we were overwhelmed, we had so many residents, we just couldn't care for our residents in such a way that we normally would. And I just do not think this, we don't believe that this is excusable. Next slide, please. So this describes some of the state actions, the state laws, the state executive orders. But now it's starting to crop up in Congress, the United States Congress on the federal level. There's already been a bill introduced by a representative from Tennessee, Representative Poe, which grants blanket immunity to nursing home facilities. It is similar to most of the laws and executive orders in the states, and it would grant immunity in most instances. And it's likely coming to the Senate. There has been talk by the Senate Majority Leader that any additional COVID relief, if there's another bill trying to provide relief to the country, immunity is going to have to be tied to that. And we're suspecting and anticipating that immunity for nursing homes will be a part of that. What's also troubling about this on the federal level is that immunity could capture much more than just negligent cases, more than just cases of claiming damages due to the facility's negligent behavior. We're concerned that the Congress could introduce a bill that allows no claims under the Americans with Disabilities Act or Medicaid claims. You know, these type of claims where you're trying to make more impactful litigation that says a facility's treatment of people with disabilities or treatment of people minorities or because of gender or of any other type of category may be precluded. And these are more impactful system-wide tools to help protect residents. And we're concerned that that possibility is coming. Next slide. One thing I wanted to talk about is how this, and it's not on the slide, but how this relates to workers as well. The industry has couched this in terms of protections for healthcare workers, for the heroes that are taking care of our loved ones in the facilities. And however, that is just, it's a disingenuous argument. Rarely, if ever, are nursing home care workers sued. One, they are underpaid and overworked, and there's really no reason to sue them. And two, it's just not, the type of harm that comes to residents is usually from systemic facility-wide problems. So we just don't see this. It's not about protections for workers. In fact, this would probably harm workers, because when this facility is less incentivized to comply with regulations, is less incentivized to make sure they're providing quality of care, more likely people are going to get sick, and more likely that means workers are going to get sick, and more likely that workers who work in these facilities may go out into the community and get community sick. So this isn't about protecting workers. This is about protecting facilities, and that is something that needs to be push back on. So what can we do? Consumer Voice has been tracking this from the beginning with a bunch of other advocacy groups, nationwide advocacy groups, and we've been trying to bring attention to this both on the state and the federal level. Legislators, and policymakers need to hear from residents and family members. A lot of legislators and their staff don't understand what this means for residents and how it's putting them at risk, and how this is not protecting nursing home residents or residents of other long-term care facilities. It's putting them in greater harm. So we've been drafting letters to committees and also trying to bring this up in the press so the issue gets out. So we recommend reaching out to your state legislators and now your federal legislators and to governors. We've been trying to encourage stakeholder groups. There's many different groups that have interested in this, from trial lawyers to resident advocacy groups, to the ACLU, to AARP. All organizations that really advocate on behalf of residents are opposed to this because they see it as such potential for such harm. And media, the media needs to hear about this. The media needs to hear through op-eds, through calls to local television stations, and other ways, just letters to the editor to hear, to let them know that people oppose this. In the future, and you should check on our website, this will be on our website as well, as we're going to be releasing a toolkit for advocacy, which will include some talking points, also some templates for letters, and some for both to governors and state legislators, but also for op-eds or letters to the editor. So you will be able to go to our website and get that information. And again, I encourage you to go to our website and look. We have in addition to the information on immunity, there's some information there, a letter that we sent to the Senate Judiciary about this, which kind of lays out our opposition. But we need to be doing more to protect residents right now and not less. And unfortunately, this trend is going to result potentially in more significant harm to residents of long-term care facilities. Thanks, and I'll pass it to Richard now. Thank you.
Sam, thanks very much. That was really interesting and useful. My name is Richard Mollett with Long-Term Care Community Coalition. I'm going to be talking a bit, as Lori said, about protecting residents from abuse, neglect, and exploitation, particularly at this time during the COVID-19 pandemic and emergency. Next slide, please. So for those of you who are not familiar with me or our organization, the Long-Term Care Community Coalition, LTCCC, we're a nonprofit, nonpartisan organization, and we're entirely dedicated to improving care and quality of life for people who live in nursing homes and in assisted living. We mostly focus on policy analysis and systemic advocacy in New York, our home state, and nationally. And in addition, we do more and more education of consumers and families long-term care ombudsman, and other stakeholders. I also want to mention we are actually home also to 2 local long-term care ombudsman programs in our home state of New York. Very proud of that. I joined LTCCC in 2002, and this month I celebrated my 15th anniversary as executive director. Our website is, which I'll mention again at the end, nursingHome411.org. Next slide, please. So I want to talk a bit, as I said, about abuse, neglect, and exploitation, and the federal requirements around that. As always with materials that that we do, they tend to be pretty content heavy, and rules, regulations, laws, etc., can be kind of hard to follow and to keep track of. As I'll mention at the end, we have a couple of fact sheets that relate to these materials and other materials that you can use. Everything is available on our website and it's free, so there's no real need to memorize any of this. I just wanted to plug in with you all because I've been so concerned about what is going on in nursing homes now during the COVID pandemic over the last several months. So this is, and everything that I talk about over the next couple of slides that you see in italics comes directly from either the federal code, that's the 42 CFR, as you can see up here, or from the regulatory guidance that CMS, Centers for Medicare and Medicaid Services, puts out, which all licensed nursing homes in the United States have to follow. So what we do, just so you know, with our materials, including the fact sheet that I mentioned at the end, is we always include, as you can see at the top of the slide here, 42 CFR 483.12, whatever the number is for the code, so people can go back. As I say, when I do an in-person training, that you don't have to say that some bald guy came in June and said, these are my rights. You can go back to the code and find it yourself if you need. The other number up here that I wanted to mention that we include is the F600 number. That represents the F tag. It's an F and then a 3-digit number. And that relates to the federal requirement, and it essentially goes to what the surveyors are looking at when they inspect the facility. It goes to when a facility is cited for failing to meet a certain standard, that it's attached to, that standard is attached to an F tag. And this is important and useful information for consumers and ombudsmen and families and those who work with them, because every nursing home has, when they're cited, they have a statement of deficiencies, it's called, and that's where all of the deficiencies or the violations that were found are documented. And then along with that, they have on the state websites and in person, if you go to a nursing home, you'll also see accompanying that the plan of correction, what the facility says it's going to do to ensure that that problem has been corrected and it's expected does not arise again. So it's really valuable, I think, to have the information with the F tags, because you can see, for instance, if your facility has been cited for F600, you could then go back to either the code or some of our materials, or just look up online and see how that relates to what the care standard is, and that therefore what you want to be paying special attention to in your facility. So here, the federal requirement for freedom from abuse, neglect, and exploitation is the resident has the right to be free from abuse, neglect, misappropriation of resident property, and exploitation. This includes, but is not limited to, freedom from corporal punishment, involuntary seclusion, and any physical or chemical restraint not required to treat the resident's medical symptoms. And just to reiterate, all of these requirements are still in place now. They've been in place over the last several months. This gets very quickly, before I move on to a number of things, certainly everything that Sam has been talking about, that we are all extremely concerned by the states and potentially the federal government taking away really the last vestige of accountability that we have at this time. But one important thing about knowing the federal requirements is that they are useful for our advocacy as individuals and our systemic advocacy. So for instance, if you are, you may not be going into a facility, but if you have concerns that relate to, for instance, misappropriation, of resident property, that you can go back to some of these requirements and use them in advocating for a resident, for his or her protection of his or her possessions, et cetera. And that's just, of course, one example. So it's important to remember, it's important for us to remind policymakers and certainly, of course, providers that these rights are still in existence. CMS, as we've talked about in previous weeks, has reduced a number of the requirements, but they have not reduced requirements relating to residents' rights, and including freedom from abuse, neglect, and exploitation. Next slide, please. So why are we talking about these requirements during the pandemic? As I noted in the top NBC News story here, elder abuse goes unreported because of coronavirus pandemic. And I just included some other past reports. As I noted before, residents have the right to be free from abuse, neglect, exploitation, the theft of their property or the loss of their property, et cetera. Nursing homes have, as we'll discuss, 100% responsibility for ensuring that those rights are protected and that residents are protected. But I know personally that this is something that I was most concerned about from the very beginning, from the beginning of March, as the pandemic started spreading from first Washington State, that residents would be particularly vulnerable, and that if staffing shortages occur, we know that 3/4 of nursing homes on a good day don't have enough staff to provide even basic clinical care for their residents, that if that was exacerbated during the any COVID-19 pandemic, as it turned out, that residents would suffer, and not just from COVID directly, but from just abuse and frankly, what we've seen is wanton and abject neglect of residents. Residents not receiving help with eating when they need help with eating, not receiving help with repositioning, and residents literally dying of dehydration, of sepsis from infections that they've developed, of loneliness, et cetera, because of negligence and lack of care. So these rights, again, are really important. Before I move on, I just want to say, I know it is, I've worked with family members now for a number of years. I know that, and I've been a family member, these rights are really hard to advocate for. You're up against a lot when you're up against a nursing home. But if we don't know what our rights are, then there's no possibility of us being able to advocate effectively for ourselves as residents, or for our loved ones, or as ombudsmen and advocates, the people that we're trying to help. So it's, I think, just really essential to know, or at least have access to knowledge of what our rights are and what the facility's responsibilities are, now as always. Next slide, please. So I want to first give just some basic definitions about what we're talking about here. One, what is abuse? Abuse is the willful infliction of injury, unreasonable confinement, intimidation, or punishment with resulting physical harm, pain, or mental anguish. I'm gonna just move on. What I wanted to put in bold, what I did put in bold here, excuse me, is that I think this is so important. Instances, and again, this is all, as you can see by the italics, sorry to interrupt myself, this is all from the federal language, from the federal guidance. Instances of abuse of all residents, irrespective of any mental or physical condition, cause physical harm, pain, or mental anguish. It includes verbal abuse, sexual abuse, physical abuse, and mental abuse, including abuse facilitated or enabled through the use of technology. And what CMS was getting at there is that, unfortunately, there have been some very disturbing reports in recent years of generally nurse aides who are taking pictures or videos of residents, sometimes residents' genitals, or residents that are covered in urine or bowel movement, and then posting it as a joke on Snapchat or other social media. And thankfully, many of them have gotten caught, but we don't know to what extent that is going on. And so this specifically addresses it. But what's so important, why I put this paragraph in bold, is particularly the irrespective of any mental or physical condition. So in particular, it means that if someone has dementia, it is not an excuse to say, well, they didn't understand what the staff was doing when the staff yelled at them, or they didn't understand what the staff was doing when the staff took their picture and posted. They're not capable of being embarrassed. That does not matter under the federal requirements, again, that every nursing home is required to meet. So it is just not an excuse, and it's so demeaning. But in any case, it is not an excuse, and I think that is so important. And that's important for all of us. You know, once again, hopefully in the future, we'll be meeting with state surveyors, as they're now required to do, you know, in person in nursing homes when we visit as families and as ombudsmen and as advocates. And this is something that we have to make clear to them, make clear to the facility, make clear to law enforcement, if we call law enforcement, that whether or not someone is has dementia and may not understand is completely irrelevant. Next definition is neglect, is the failure of the facility, and of course Sam was talking about this, its employees or service providers to provide goods and services to a resident that are necessary to avoid physical harm, pain, mental anguish, or emotional distress. Sexual abuse, of course, is non-consensual sexual contact of any type with a resident. And willful, which Sam was talking about a bit, willful means, in the context of abuse and neglect, it means that the individual, the actor, must have acted deliberately, not that the individual must have intended to inflict injury or harm. And we're going to talk a little bit more about that. Next slide, please. Thanks. So first I wanted to talk about, these are, again, CMS language. What are the key elements of non-compliance with these federal standards? So one, the facility has failed to provide a resident's right to be free from any type of abuse, including corporal punishment and neglect that results in or has the likelihood to result in physical harm, pain, or mental anguish, or the facility has failed to ensure that a resident was free from neglect when it failed to provide the required structures and processes in order to meet the needs of one or more residents. And I think just it's important to note here, as Sam was saying, we're all extremely concerned about those immunity clauses, but that does not affect the extent to which nursing homes still are responsible for meeting these requirements. What it affects is one of the ways in which we can convince them or push them to undertake or to carry out those requirements for their residents. But those requirements still exist and they're still enforceable. For instance, if some of these, in fact, we'll talk about this a little bit later, some of these are also are crimes. So a facility or facility staff could be held criminally liable for breaking the law, et cetera. Next slide, please, excuse me. So here are some more excerpts from the federal guidance about what the facility's responsibility is. The facility must provide a safe resident environment and protect residents from abuse. Not may provide, not can provide, if it's possible, if it can hire enough staff, if it wants to pay the staff enough, if it wants to do the trainings, must provide a safe resident environment and protect residents from abuse. So they give, and I think this is really, really interesting. So CMS gives in the guidance some facility characteristics associated with increased risk of abuse. These are principally for surveyors, what surveyors should be looking for, but of course they really point out what we should be looking for too as residents and families and ombudsmen and advocates. So these are some facility characteristics that could increase the risk of abuse. This is not, again, my language, this is federal guidance. Unsympathetic or negative attitudes towards residents, chronic staffing problems, lack of administrative oversight, care staff burnout, stressful working conditions, poor or inadequate preparation or training for caregiving responsibilities, deficiencies in the physical environment, and facility policies that operate in the interests of the institution, rather than the residents. So all things that we should be looking at, thinking about, especially now when we can't go in. So yes, we can't necessarily see some of these things or witness them in person, but if we're able to talk to our resident, if we're able to talk to the provider, to the administrator, to ask about these questions, to look at the data. For instance, CMS posts the staffing data on a quarterly basis. It is historical, but you know that if your facility came into the pandemic with insufficient staffing, it's likely that that is an issue that has also become exacerbated at this time. So things to ask questions about, things to look into, et cetera. And we provide, I think many of you know, we provide the staffing data for every facility in the country that's in compliance with that federal reporting requirement on our website on a quarterly basis. Next slide, please. So I'm going to talk about a couple specific types of abuse. One, of course, is staff to resident abuse, which is something we generally think of as being the biggest concern. This, again, as you can see, it's pretty much all italicized. So this is all the federal language. Nursing homes have diverse populations, including, among others, residents with dementia, mental disorders, intellectual disabilities, ethnic cultural differences, speech language challenges, and generational differences. When a nursing home accepts a resident for admission, the facility assumes the responsibility of ensuring the safety and well-being of that resident, period. It is the facility's responsibility to ensure that all staff are trained and knowledgeable on how to react and respond appropriately to resident behavior. Staff are expected to be in control of their own behavior at all times and to behave professionally. A facility cannot disown the acts of its staff. So CMS does not consider striking a combative resident an appropriate response in any situation. It is also not acceptable for an employee to claim his or her action was quote unquote reflexive or a quote unquote knee-jerk reaction and was not intended to cause harm. Retaliation by staff is abuse regardless of whether harm was intended and must be cited. So again, by must be cited means it is a violation of the basic standards of care. Next slide, please. I'm going to talk a little bit over the next two slides over resident to resident abuse, because I thought it was, and we know that it's an issue. I think the Consumer Voice last year at the annual conference had someone who presented, Elon Caspin, who's done some research on this. But in any case, I wanted to just lay out some basic information because this is so important, especially when it comes to residents with dementia or other cognitive issues. A resident-to-resident altercation should be reviewed by surveyors as a potential situation of abuse. So we should understand it as a potential situation of abuse. And if we hear about an altercation that our resident has with another resident, that shouldn't just be sloughed off as it wasn't abuse, it wasn't something that for which the facility is responsible, etc. Should be reviewed as a potential situation of abuse. Having a mental disorder or cognitive impairment does not automatically preclude a resident from engaging in deliberate or non-accidental actions. And here's where I wanted to talk about what willful means in this context. The word willful means that the individual's action was deliberate, not inadvertent or accidental, regardless of whether the individual intended to inflict injury or harm. So two quick examples. An example of a deliberate, willful action would be a cognitively impaired resident who strikes out at a resident within his or her reach, as opposed to a resident with a neurological disease who has involuntary movements, such as a muscle spasm or twitching, and his or her body movements impact the resident who is nearby. So again, willful versus non-willful, and willful actions are what we're talking about here. Next slide, please. A little bit more on resident-to-resident abuse. This is particularly about what the expectations are of the facilities, because too often, as I said, the facility will just slough it off as saying, oh, that resident wanders, that resident has, has sexual proclivities, like they distance themselves. He or she has dementia, and they, and they get into bed with other people, or they hit other people, and there's nothing we can do. So here it says, if it is determined that the action was not willful, not a deliberate action, so then the surveyor must investigate whether the facility is in compliance with the requirement to maintain an environment as free of accident hazards as possible, and that each resident receives adequate supervision. As staff at the Consumer Voice have heard me say before at meetings, this is not a YMCA where they're getting paid the nursing home is getting paid $25 a day to give a resident a couch and access to a bathroom and a washcloth. They are responsible for ensuring that any resident that they accept receives adequate supervision. The facility may provide evidence that it completed a resident assessment and provided care planning interventions to address a resident's distressed behaviors such as physical, sexual, or verbal aggression. However, based upon the presence of resident-to-resident altercations, if the facility did not evaluate the effectiveness of those interventions and staff did not provide immediate interventions to assure the safety of residents, then the facility did not provide sufficient protection to prevent resident-to-resident abuse, period. Next slide, please. So before I end, I wanted to just mention a little bit, as I said before, that many of these things are actually also considered a crime. So there are requirements and federal regulations in regard to protecting residents from abuse, neglect, theft, exploitation. There were also requirements that came about in 2010 as a result of the Affordable Care Act, so-called Obamacare, which specifically got to crimes against nursing home residents. And what that says is that there is a reporting requirement to law enforcement as well as to the state agency within a very short period of time, within a 2-hour period of time, if there is a suspicion of a crime taking place against a resident. So excuse me, that reporting requirement is immediately, it has to be done within 2 hours if the act or incident suspected to be a crime resulted in physical injury to a resident. Otherwise, it must be done within 24 hours. But it's really immediate reporting. Report now, but no later than 2 hours, or you're out of compliance with this requirement. The duty to report goes to all nursing home employees, care staff, as well as administrative staff, the owners and the operators, the managers of the facility, as well as any agents and contract workers that are coming in, including someone who might be doing delivery, someone who might be providing therapy services from the outside. Those are not an excuse. When the facility who has total control over the nursing home brings someone in or allows someone to come in, they take that responsibility. And those individuals, they take the responsibility to inform these individuals, and those individuals have the responsibility to report any reasonable suspicion of a crime against a resident in the facility. The penalties are very high, and this is something that we were frankly really excited about, that it could be up to $221,000 now if for the failure to report, and up to over $330,000 if the failure to report results in increased harm to the victim or harm to another resident. So I thought that was really valuable. Next slide, please. I want to say before we move on, it is a really valuable requirement that was implemented as part of the Affordable Care Act. However, it has not been very well executed by either the state agencies, the state departments of health, or departments of public health, or CMS. And that's something that we, CMS, and the Consumer Voice, Center for Medicare Advocacy, Justice and Aging, California Advocates for Nursing Home Reform, that we've been working together to try to get improvement both with CMS and on Capitol Hill, because it is such an important protection. And I think it's beyond shameful that we haven't seen it well implemented. So very quickly, I won't go into it, but we have this chart of exactly what is reported, what is required to be reported in terms of suspicion of a crime against the resident, as well as what is required to be reported in terms of abuse, neglect, exploitation, et cetera, by whom, to whom, et cetera. And you can see again the regulatory code as well as the FTEC. Next slide, please. So as I mentioned at the very start, we have this all in a fact sheet. It's available on our website, in the Learning Center of our website. We have fact sheets, et cetera. But this explains what the guidelines are, what some of those definitions are I mentioned, et cetera. Next slide, please. And I just want to show 2 quick pictures of where these resources are available. So this is our homepage. As you can see on the left-hand side in the column, we have the Learning Center. If you click on the Learning Center, it'll take you to different materials. We have a dementia care advocacy toolkit. We have these fact sheets. We have other handouts. And then next slide, please. We have an abuse, neglect, and crime reporting center that we are continually updating. So we actually did a report on this last year on policies in regard to addressing abuse, neglect, and suspicion of crime against nursing home residents. But as you can see on the side, we have a variety of links to the state agencies, to complaint forms, to the Medicaid fraud control units. We just added, you can see at the bottom, some from the American Bar Association abuse definitions in state laws. And then we have some forms and tools both for reporting and for if you're doing systemic outreach to law enforcement in your community or in your state. And I think that's it for me. Is that the last slide? Thank you. I'm going to hand it over to Lori, and thank you very much.
Thanks so much, Richard and Sam, for your excellent presentation. So very informative and timely with everything that's been going on. And particularly, Richard, your presentation, considering that Monday of this week was World Elder Abuse Awareness Day, where across the world people were focused on and highlighting issues around elder abuse prevention, ways to respond to elder abuse, and so I think it was very timely that you presented this today for folks to listen to. I wanted to also share that there are a number of resources on the Consumer Voices website that you can also access for families, for ombudsmen and other advocates related to all of the issues that we've been talking about over the last several weeks. And next slide, please, Libby. There are a number of new resources that have been posted within the last couple of days, and you'll see the highlights of those on the screen in front of you. Some tips for ombudsman programs on communicating with residents and families and long-term care facilities during this crisis. It's on both the Ombudsman Resource Center website as well as the Consumer Voice site. Yesterday, as I mentioned earlier, there was a webinar for family members on advocating for residents during this COVID emergency period, and the recording and slides are now available there as well. And the Consumer Voice worked with the National Center on Elder Abuse on some resources, including what you see there, Keeping Family Together During COVID-19, a checklist. That's the National Center on Elder Abuse resource that looks at how families really could communicate well together and work well together in order to prevent abuse when you have multiple people or even multiple generations living at home, to reduce stress and conflict that may occur when you're living together. And then we had gotten a lot of questions very early on about whether or not a person should take their loved one home from a nursing home during this crisis. And we worked with the National Center on Elder Abuse on some information and things to consider if that is something that you are either considering doing or wanting to do. There are a number of things you should consider and have a good plan in place prior to removing a loved one from a facility so that you can ensure that they are getting the best care possible at home. Next slide, please. Also, as a reminder, we launched a couple weeks ago a place for you to share your stories on the Consumer Voice website, and so you can go to the link there, click on the COVID pages, and there is an opportunity for you to share your experiences with care, both good practices as well as challenges that you and your family members may be experiencing during this COVID emergency. And those are things that we are very interested in hearing about. And we don't share your personal contact information at all, but the information you share is very useful as we think through advocacy and strategies for moving forward. So with that, turn to the next slide, please, Libby. We have about 5 minutes left for questions, and I know there's been a lot of questions coming in and a lot of chat going on in the chat box. So why don't I turn to Jocelyn and maybe Sam to see if there are some particular questions that we could queue up to get started with today.
Sure, Lori. There are a couple questions in both sections of the webinar today. First, Richard, there were a few people asking, why is abuse and neglect so difficult to prove? And to show, someone was saying that even when they have documents and pictures and hospital reports, they're still not getting any traction. So if you could speak to that for a moment.
Sure, I think that's a very good question. To my mind, it really gets to the to what unfortunately we've seen happen, especially over the last several months, is that people in nursing homes are disregarded by society to a large extent. So, so we see abuse and neglect, and we maybe even have documentation of that, but it's kind of poo-pooed, for lack of a better way of putting it, by the authorities. And so that I think is the underlying issue that gets to that. I mean, there are some, I know I don't want to get into it, but there are issues in terms of evidence, et cetera. I do know of cases where facilities, excuse me, where attorneys and attorneys general have used residents' pictures and residents' video when they've had it in camera in support of a criminal litigation against the facility or its staff. So that does happen. But I think, as I was saying, I think overwhelmingly we have a disregard and a disrespect for the lives of older adults, especially those in nursing homes.
Thanks, Richard. Anyone else want to comment on that before we move on to another question? Okay, I think it was a really good answer. So thank you, Richard. Another question, Jocelyn?
Sure. I'll stick with you for a minute, Richard. How is COVID and neglect we're seeing playing into this? We've heard several reports of residents being denied certain things because of COVID, but someone specifically asked about the situation where residents are being isolated in areas where they're not permitted to shower or bathe and they only have sponge baths. And that this is leading to skin conditions and all different problems. So are COVID-related neglect issues something that people should be pursuing under this, or is that just something that is considered, because of COVID? Like how, I guess, do people draw the line over what they should be looking at?
Well, I think they should definitely be looking at that. And for the reasons you just stated, is that it's not, that, oh, I like taking a bath and I miss my bath time, is that not taking a bath is unsanitary and could lead to significant health problems. And there are other ancillary benefits of being bathed, is that, whoever's helping with the bath could also see if, how the resident is doing, whether maybe they're dehydrated, maybe they have bruising, et cetera. So those things are really important. So yes, it's certainly neglect. As to get back at what Sam was saying, unfortunately, I think we've been really hobbled over these last several months with families and ombudsmen not going in, with the state agencies not going in, or the health departments, and with the and with the inability in many states to even sue for these conditions. That's exactly the kind of neglect and the impact of those neglects that we are most concerned about. So yeah, I think those are important. I think we should speak out, and that's why we wanted to talk about it today.
Mm-hmm. Yeah, I agree with what you're saying, Richard. I mean, we've heard a lot about situations where people have not been getting actual baths or showers during this whole emergency period, during this whole crisis period. And the residents who spoke to us who have been in that situation talk about how they feel about it as well. I mean, in addition to the hygiene and the skin breakdown issues that Richard was talking about, just the mental reaction to not being able to take a bath and feel clean and feel good about themselves, I think has been also another issue. This is definitely an area that maybe some advocacy can be done at the state level, both with facilities and with their state their state entities and agencies around, really pushing to put better practices in place at the facility level during this crisis period. Maybe one more question, because we're coming close to the top of the hour.
Sure. This one is for Sam. There were several people asking about the immunity laws and their impact on workers in the facility. Specifically, there's been a big push for employer immunity, but if an employee of a facility is injured or if they get COVID because of negligent practices, do these immunity laws prevent them from bringing a lawsuit against the facility?
Right, that's a great question. The majority, and I'm going to say pretty much all of these laws and executive orders are about care. They're not about being exposed at work. We certainly believe that the federal legislation that is on the horizon regarding immunity will be more broad, and it's going to cover um, employers who open and they're at their places of work. In this instance, it'd be a nursing home, were exposed to COVID and became sick. So these what we discussed today are really about negligent care of residents. But it is on the horizon that there will likely be legislation on the federal level and probably on the state level too, as things move along, that exempt facilities from being held accountable for poor conditions that resulted in workers being harmed from COVID.
Thanks, Sam. So we are at the top of the hour today, so thank you all for joining us. I would like to again thank Sam and Richard for their presentations, and Jocelyn and Libby for helping out with behind the scenes today, and also to Eric and Toby for being available to assist with questions and supporting the program today as well. Join us again next week for our next installment of the webinar, and please enjoy the rest of your day. Have a good weekend and stay safe. Thank you.